My name is Georgia Tipo, and my speech is about sickle cell. Giving a speech might not be as easy as faking a smile. It will amaze you all how uncomfortable you make me feel by standing in front of you. Today, I chose to wear red and white. Red represents the hemoglobin red blood cells, and the white for purity, hope, and courage to move on. As we all know, there is every purpose under this heaven. A time to be born and a time to die. A time to cry and a time to laugh. A time to achieve and a time to lose. Born with a sickle cell disease and do not know the time to die, the time to cry, and the time to laugh, neither do I know the time to achieve and the time to lose. I live each day with hope, courage, and the desire of leaving a significant impact on all. There has been a lot of misconception about the disease sickle cell. This and no fault of any other. If corporate organizations and health departments could raise an alarm of education to educate the general public on this issue, people will understand individuals with the disease and will also know how it's contracted. By the end of my speech, I hope to achieve that. I quite remember when I first told someone I had sickle cell. The first question that popped up was, what is that? And is it contagious? And how is it gotten? Would you blame someone for asking such questions? Certainly not. According to Dr. William C. Shell, sickle cell anemia is a disorder of the blood caused by an inherited abnormal hemoglobin. The abnormal hemoglobin causes distorted red blood cells. The sickled red blood cells are fragile and prone to rupture. When the number of red blood cells decreases from rupture, anemia is the result. This condition is referred as sickle cell anemia. The irregular sickle cell also blocks vessels, causing tissues and organs damage and pain. As an illustration, this shows the irregular blood cells, and that is the normal hemoglobin blood cell. Sickle cell anemia is one of the most common inherited blood anemia. The disease primarily affects Africans and African Americans. It is estimated that in the United States, some 50,000 African Americans are affected with the most severe form of sickle cell anemia. Overall, current estimates are that 1 in 1,875 U.S. African Americans is affected with sickle cell anemia. How is sickle cell anemia inherited? Sickle cell anemia is inherited as an autosomal recessive condition, whereas sickle cell trait is inherited as an autosomal dominant trait. This means that the gene can be passed from one parent, carrying it to a male and a female children. In order for a sickle cell anemia to occur, a sickle cell gene must be inherited from both the mother and the father, so that the child has two sickle cell genes. The inheritance of just one sickle cell gene is called sickle cell trait, or the carrier state. Sickle cell trait does not cause sickle cell anemia. Persons with sickle cell trait usually do not have many symptoms of disease and have normal hospitalization rates as well as life expectancy. Sickle cell trait is present in some 2 million blacks in the United States. When two carriers of sickle cell trait mate, their offspring have 1 in 4 chances of having sickle cell anemia. Virtually all of the major symptoms of sickle cell anemia are the direct result of the abnormal shaped sickle red blood cells blocking the flow of blood that circulates through the tissue of the body. The tissue with impaired circulation suffer damage from lack of oxygen. Damage to tissues and oxygen to the body can cause severe disability in patients with sickle cell anemia. The patients endure episodes of intermittent crisis of variable frequencies and severity depending on the degree of organ involvement. The major features of sickle cell anemia include fatigue and anemia, pain crisis, dactylitis, which is swelling and inflammation of the hands and feet, as well as arthritis, bacterial infection, splenic sequestration, which is sudden pooling of blood in the spleen, and liver congestion, lung and heart injury, leg ulcers, aseptic necrosis and bone infarct, eye damage, and other features. Some features of sickle cell anemia, such as fatigue, anemia, pain crisis, and bone infarct, can occur at any age. Many features typically occur in certain age groups. Sickle cell anemia usually first presents symptoms in the first year of life. Infants and younger children can suffer with fever, abdominal pain, pneumococcal bacterial infections, painful swellings of the hands and feet, and splenic sequestration. Adolescents and young adults may commonly develop leg ulcers, aseptic necrosis, and eye damage. Symptoms in adults typically are intermittent pain episodes due to injury of bone, muscle, or internal organs. Affected infants do not develop symptoms in the first few months of life because the hemoglobin produced by the developing fetus protects the red blood cells from sickling. This fetal hemoglobin is absent in the blood cells that are produced after birth, so that by 5 months of age, the sickling of the red blood cells is prominent and symptoms begin. The treatment of sickle cell anemia is designed according to which of the individual features of the illness are present. In general, treatment is directed at the management and prevention of the acute manifestations, as well as therapies directed towards blocking the red blood cells from stacking together. There is no single remedy to reverse the anemia. It is therefore important that family members have an optimal understanding of the illness and communication with the doctors and medical personnel be maintained. Finally, as to the misconceptions surrounding the disease, in Africa where I come from, sickle cell clinic and HIV clinic share the same entrances. And in the United States, the sickle cell and the cancer clinic also share the same lab premises. Thus, both of them are referred as comprehensive care. How then are people going to know where you stand as the symptoms are equally common among the three? But I hope my speech has cleared a bit of the air. Sickle cell is hereditary. HIV is sexually transmitted. Cancer can be hereditary and acquired. I know by now you all will be wondering which of the symptoms I have experienced yet. You are all entitled in asking, and I will gladly tell you. Thank you for your time and patience for hearing me out.